My topic today is autoimmune disorders and how to avoid these. So I'm a pediatrician. I had a busy day at the office with the usual strep throats, croup, diarrhea. We had, oh gosh, I had some ADD, ADHD visits. Pretty typical pediatric day, but I had one patient that prompted me to want to talk about autoimmune disorders. This was a young man, 11 years old. Parents called today, worried he'd lost about 10 pounds in 10 days, and they just didn't think he looked right. I knew I was going to be walking into something that was a little more serious than your usual pediatric visit. And sure enough, this young man, he just looked sunken eyes and pale. He didn't look well. After getting an extensive history, I hadn't seen him for 3 years. Last time I saw him, he had just had an appendicitis after his appendectomy 3 years previously. He's been healthy. They do have a family history of some autoimmune things. A sister with Hashimoto's thyroiditis, family history of thyroid problems, of cancers. And so long story short, we got a urine. There was 4+ ketones, 4+ glucose in the urine, and blood glucose was 425. So, you know, he's a new diabetic, insulin dependent for sure, and we got him arranged to have him admitted to the hospital. He's in intensive care at the time being. It got me thinking, why are we seeing so much autoimmune issues, more diabetes? You know, we think that autoimmune is sometimes involved in autism. We're not sure about that. Certainly, some of the arthritises are autoimmune. The thyroid issues a lot of times may be autoimmune. And you know why? I'm certainly seeing more diabetes than I ever did before. So I thought I would share with you a couple thoughts. I just started a new clinic, Natura, where we can see adults. It's a blend of naturopathic medicine where Dr. Zelfand, naturopath, and I blend our integrative medicine and naturopathic medicine skills. And at this intersection of the disciplines of medicine that are looking for root cause of what's causing our challenges in our health today, we are continually finding there are food sensitivities, there are environmental toxins, there are nutritional deficiencies, and at that intersection, the autoimmune condition is also sometimes prominent. We were chatting about the issue of gluten the other day, and Dr. Zelfand has been gluten-free for, I think, a few years. I've just started becoming gluten-free myself. And asking her, well, why are you gluten-free? Her response was quite telling. So while in naturopathic medical school, one of her professors asked the class, how many of you are gluten-free? And about a third of the class raised their hand. And he says, so what's wrong with the rest of you? You just going to wait till you have an autoimmune disorder? You see, gluten is known to be a huge stimulator of autoimmune issues. Now, I'm not saying that my young man today wouldn't have diabetes had he been gluten-free. We'll never know. But I do think it's something that in this country we just have to start wondering. The state of our wheat has just been modified so much that it's foreign to our immune system. It really is, I think, for many people, becoming a toxin that just has to be avoided, or you run the risk of autoimmune disorders. For adults, we're talking MS, for example. This is autoimmune, lupus, rheumatoid arthritis, and I think there are a host of other things that are not as well defined that might be tied in with autoimmune issues. The other big thing for autoimmune that I just have to mention is aspartame. So aspartame is what's in NutraSweet and Splenda. This is what's in diet drinks in the United States and now most countries in the world. And you know, it was a disaster that we have added this to our food chain, because here's what it does. Aspartame is actually converted to methanol in our body. Methyl alcohol, methanol, wood alcohol, is a huge toxin in very small doses. In our body, that molecule of alcohol is so small that it can get into any cell. So it gets into the cells around your blood vessels. It gets into cells in the brain. And so wherever methanol goes, if the enzymes are there to convert it to formaldehyde, it's converted to formaldehyde. And that's the disaster, because formaldehyde is a poison that our bodies will do almost anything to get rid of. We add teeny amounts of formaldehyde to vaccines because, boom, you get a huge immune response. So imagine now you've got formaldehyde around the lining of your cells in your brain, your nerves. That's MS, autoimmune attack of your cells lining the nerve cells. You've got formaldehyde molecules in your pancreas. Boom, you've got perhaps diabetes. In your joints, you've got arthritis. You get the picture. If it's in your lining of your hearts, maybe heart disease. We have got to stay away from methanol, from aspartame, anything diet that has aspartame. If you have loved ones who, I'm ashamed to admit it, but I was drinking Diet Coke till not that long ago, until I read a book called While Science Sleeps by Woodrow Monty. Brilliantly explains this whole aspect of how methanol becomes formaldehyde, a sticky molecule that then triggers that immune response. So in short, don't drink diet drinks. If you can possibly do it, I would avoid gluten at all costs and just get it out of your diet if you live in the United States or in these areas where we have gluten that's so modified that I think it's a toxin to too many people. Thanks for watching. Sorry I rambled a bit. I'm Dr. Paul.